Which vaccine must be administered within 24 hours of birth to maximize prevention of perinatal transmission? Correct answer is option C. Hepatitis B birth dose. The minimum interval between two primary doses of pentavalent vaccine is. Correct answer is option C. 4 weeks. A child develops anaphylaxis after vaccination. This is classified as. Correct answer is option B. Serious AEFI. A child received pentavalent 1 at 6 weeks and returns after 3 months. The nurse should. Correct answer is option C. Continue from the next due dose. Failure of BCG vaccination is most commonly indicated by absence of. Correct answer is option B. Scar formation. Simultaneous administration of multiple vaccines during one visit is recommended because it. Correct answer is option C. Improves coverage and compliance. Maternal antibodies may interfere most with the response to. Correct answer is option A. Live vaccines. OPV provides strong intestinal immunity because it replicates in the. Correct answer is option C. Intestine. Which vaccine should never be administered in the gluteal region because of reduced efficacy? Correct answer is option A. Hepatitis B. A child received OPV at birth 6 weeks and 10 weeks but missed the 14 weeks dose at 8 months of age. The best action is. Correct answer is option C. Give the missed OPV dose and continue schedule. A vaccine derived from a weakened pathogen is called. Correct answer is option C. Live attenuated vaccine. Which vaccine preventable disease can cause congenital defects if infection occurs during pregnancy? Correct answer is option B. Rubella. A child with mild fever and common cold present for vaccination. The nurse should. Correct answer is option B. Vaccinate as scheduled. Which of the following is not a true contraindication to vaccination? Correct answer is option A. Mild respiratory infection. Herd immunity means. Correct answer is option B. Community protection when enough people are immune. Which immune cell is primarily responsible for antibody production after vaccination? Correct answer is option B. B lymphocyte. The main advantage of combination vaccines such as pentavalent is. Correct answer is option C. Fewer injections and improved coverage. After reconstitution, measles vaccine should be used within a limited time because of. Correct answer is option A. Rapid loss of potency. The first booster of measles containing vaccine is usually given at. Correct answer is option A. 18 months. The immune response generated after vaccination and memory cell formation is known as. Correct answer is option B. Artificial active immunity. A newborn baby is brought to the vaccination center immediately after birth, which vaccine is given intradermally. Correct answer is option C, BCG. A mother asks why vaccination is important for all children. The best answer is correct answer is option B. It prevents diseases. The vaccine while monitor is checked before vaccine administration. What is its main purpose? Correct answer is option C. Detect heat exposure. BCG vaccine is mainly given to protect children against. Correct answer is option C. Severe tuberculosis. A nurse administers pentavalent vaccine to a 10-week-old infant. Which dose is being given? Correct answer is option B. Second dose. A child develops difficulty breathing immediately after vaccination. Which drug should be given first? Correct answer is option B. Adrenaline. A vaccine refrigerator shows a temperature of +4 degrees Celsius. What does this indicate? Correct answer is option A. Cool chain maintained. A 9-month-old child has completed all previous vaccinations according to schedule. Which vaccine is due now? Correct answer is option B. Measles. During immunization, the nurse administers a vaccine orally to an infant. Which vaccine is most likely being given? Correct answer is option C. OPV. A child comes for the first routine immunization visit at 6 weeks of age. Which vaccine is included at this visit? Correct answer is option B. Pentavalent 1. When a large proportion of a community is vaccinated, disease transmission decreases. This concept is called. Correct answer is option C. Herd immunity. A mother asks why vaccines are stored in a cold chain. The main purpose is to. Correct answer is option B. Maintain potency. A severe allergic reaction following immunization is known as. Correct answer is option B. Anaphylaxis. A nurse explains that vaccines stimulate the body's defense mechanism. This process produces. Correct answer is option B. Immunity. A newborn receives BCG vaccination. What is the usual site of administration? Correct answer is option B. Left upper arm. A child develops mild fever after vaccination. What should the nurse explain? Correct answer is option A. It is a common minor reaction. A nurse checks the immunization card of a 9-month-old child. Which vaccine is commonly due at this age? Correct answer is option B. Measles vaccine. A mother brings her child for routine vaccination at 10 weeks. Which pentavalent dose should be administered? Correct answer is option B. Pentavalent 2. A nurse prepares BCG vaccine before administration. Which route should be used? Correct answer is option D. Intradermal. A child visits the API center at 14 weeks of age. Which pentavalent dose is due at this visit? Correct answer is option C, third dose. A vaccine is given to protect against poliomyelitis through the oral route. Which vaccine is it? Correct answer is option B, OPV. The ultimate goal of EPI programs is. Correct answer is option B, disease prevention through immunization. Vaccine coverage refers to. Correct answer is option B, percentage of target population vaccinated. Which vaccine protects against Haemophilus influenza type B? Correct answer is option B, pentavalent. Auto-disable settings are used to. Correct answer is option B, prevent reuse. Which disease has been eradicated globally? Correct answer is option C, smallpox. Vaccine wastage rate is highest in. Correct answer is option B, multi-dose vials. Which vaccine should be protected from sunlight after reconstitution? Correct answer is option A, measles vaccine. Hepatitis B vaccine is usually administered. Correct answer is option B, intramuscularly. TD vaccine protects against. Correct answer is option A, tetanus and diphtheria.